next lead paper by Professor Vivian Lin. Professor Lin is the Executive Associate Dean at Shing Faculty of Medicine at the University of Hong Kong. She has 40 years experience in public health. She was the chair of public health at Trobe University in Melbourne before serving the WHO as Director of Health Systems in the Western Pacific Regional Office. She is the author of several leading textbooks in Australia on health policy and planning. Vivian is also consulted widely by the World Bank, UK Department for International Development, Australian Agency for International Development, as well as she has served on multiple boards in relation to health promotion, public health, education, and research as the chair of the Australian National Network of Academic Public Health Institutions, and complementary health workforce regulation, notably as inaugural president of the Chinese Medicine Registration Board of Victoria, and China relations, including Australia-China Council. Vivian has a BA from Yale, an MPH and DrPH from Berkeley. And I'm very pleased to invite Vivian for this presentation, which will be on science, health, and foresight analysis. Foresight in the time of COVID-19. Yes, thank you.
Thank you so much. It's a great pleasure to be able to join you. There's been, we know, a huge amount of collaboration in the time of COVID between the basic and medical sciences. And as our opening speaker said, it's time to bring in the social sciences as well. And in talking about foresight, I will be talking about the interdisciplinary work and bringing in more social sciences with a focus of thinking about building back better and beyond. So more specifically, what I will do is to talk in more detail about the COVID Futures think tank that the World Health Organization of the Western Pacific Regional Office had actually undertaken using this methodology. So let me go to my slide share. Apologies, found it. Okay.
Thank you.
So there's a number of acknowledgments to be made. The first is really to all the public health experts who have long predicted that we were going to be seeing a pandemic sometime in the future, and the future is now. And of course, it may be one thing to say it's coming, it's another thing to think about, what do you do? So the regional director in the Western Pacific Regional Office, on taking office in 2019, suggested that to be prepared for the future, we need to actually think about backcasting as the way of working. So then COVID struck, and the Futures think tank were really the first attempt to use this approach to see if it actually helped us manage better and recover. So 4 think tanks were held around COVID. I'll describe the non-pharmaceutical interventions, but there was also one on equity, one on economics, one on ethics, and one on non-COVID mortality, for instance, cancer, heart disease, etc. And coming out of that, people said the history also matters because where we are today is a reflection of yesterday. And today is going to actually frame tomorrow. So there was another think tank on history that was held. And of course, all of this has been supported both by the WHO staff and also professional support from people who might be labeled futurists. So I want to just acknowledge all the input from these people in what I will be talking about. And so I want to talk a little bit about why Foresight and what these think tanks did. I want to tell you about what were the conclusions based on this methodology back in 2020, but also here we are in 2022, how do we actually reflect on that exercise and then talk about the future of foresight in the WHO and beyond. But because yesterday comes to today and today leads to tomorrow, I want to start with history. History of epidemics matter a lot. And when we think about history, we know that the public health system as we see today had some of its early origins during Black Death, when Italian cities set up temporary boards of health and then made them permanent. At that time, they issued passes to travelers and they instituted quarantine arrangements. And of course, that is what we're also living with. But these past epidemics have also led to changes in health services delivery. During the Black Death, plague hospitals were invented to isolate those who were ill. In the Spanish flu epidemic, just over 100 years ago, flu hospitals were also set up, but they went beyond isolation, but to also provide supportive care to individuals to help people recover. So we can see how there has been cumulative lessons. But the thing that we have perhaps not learned as much is every epidemic has revealed structural inequalities in our society. As example, the cholera outbreaks in the 1800s actually fueled a lot of social unrest. There was an emerging sanitary movement that pushed for clean water and wastewater. So this is interesting to reflect in our current circumstances where we see structural inequalities, we see social unrest, but we are also seeing some movements to build back better in a number of different ways. So then the question becomes, having had COVID now for 2 years, what can we anticipate and plan better in order to recover and to prepare for the next epidemic? I think there are a lot of shared experiences of a negative, but not completely negative sort. If we think about the early days of COVID in so many countries, we had supply problems, whether that was the public health supply, the equipment and devices, or the care supply. We saw in every country that there were certain populations that were very high risk. These were migrants, the people in insecure employment, people with underlying conditions, many of whom are aged. And we also saw the rise of mental health issues, gender-based violence. And many countries responded with vaccine nationalism at the time when global solidarity was being called for. But behind every one of these experiences, there were also some transformational possibilities that emerged. Digital health is a big one in many, many places. And those changes look like they will stay. Many countries started to reorganize supply chains. There was much greater focus on primary healthcare and community engagement. And outside of the health sector, we've seen engineers talking about better quality buildings, healthy buildings. We've seen people in social sector talking about the need for better social protection systems. And many businesses are now preparing for whether the workplace will be transformed because people want to continue to work from home. So how do we actually bring this into the future? Well, I have to say that historically, public health hasn't necessarily been particularly good at this, in the way that conventional disease control programs work, and our response to COVID certainly initially was in this approach. It's very rational. We look at the scientific evidence, we look at the epidemiology, we look at the data. We assume that we can control the risk factors and we can fix it, and there's not going to be external disruptions. Well, this has not quite been the COVID experience, but we do have other examples where foresight has been applied, typically not to disease control, but to complex public health problems. When linear thinking was not sufficient, or there were certainly many uncertainties. And some of the most notable examples globally, the UK had a foresight program that looked at the myriad of complex factors that was contributing to the obesity problem as a way of helping to think through the solutions. And the Dutch undertook a foresight study as part of development of national health policy. And perhaps surprisingly for many, compared with the beginning of the exercise, youth mental health emerged as a really significant priority. And in Australia, the Cooperative Research Centre for Aboriginal Health, now known as the Lowinger Institute, actually used foresight as a way of research priority setting. So instead of thinking about what's today's issue, they really said, what's the future that we need to have better research? And then thinking about how research can help pave the way for different kinds of futures. So in a nutshell, there's a number of different ways in which foresight can be useful. Foresight in the first instance helps you ask good questions, critical questions, systemic questions, provocative questions. And in doing so, it challenges the assumptions and the things that we take for granted and push us towards more innovative thinking and better preparedness. It boosts the creativity in the way that we do our analysis and in the way we look for solutions. And instead of thinking for the one size fits all, what's the one magic bullet? What's the one intervention that will fix it? We accept diversity of context and therefore a need for a range of different tools and interventions to solve our problem. And in that way, we can manage uncertainty better, we can test different ways of working, and we can think about adaptation and resilience. So what does it look like? Well, in the top, we see that linear thinking, where we think about the facts, we think about the trends, we try to predict. And so forecasting is one of the very standard practices we see in many disciplines. But when we think about futures work, foresight, we are thinking about scenarios. We recognize the present reflects the past, but what we want to do is to envision the future. We want to think about alternative scenarios. We want to understand the drivers of change that gives us these uncertainties. And then we want to do our backcasting to think about how do we get to different futures. So let's go into an example of a futures think tank. Now, remember that this was April 2020, about 3 months after COVID started, when knowledge was still evolving. And I want to give you an example from the non-pharmaceutical interventions, which is sometimes also known as community mitigation. And this is what we talk about as social distancing, wearing masks, and so on and so forth. And so in doing this think tank, the WHO wanted to think about how the implementation of these measures between that point in time of the pandemic and when the vaccine became available will impact on people's health, health systems, and what did it mean for moving forward. Now, the interesting thing I also think to reflect on 2 years down the track is some of the trends and the assumptions that we actually had. Firstly, one of the assumptions in going in is that the social distancing and other MPI measures were appropriate and would be accepted by most of the community, so perhaps underscore most. We thought that effective vaccines would be available in 18 to 24 months, and it turns out to be more like 18. So we were not too bad on those two, but we also thought that there would not be very much mutation, so the vaccine can be developed quickly and be highly effective. That we're being challenged by that. We were also thinking that the biological response would be predictable, and therefore antibodies would protect from reinfection. Here again, the science is challenged our thinking, but nonetheless, part of the future foresight work is being able to take account as you go on. So what did we do? Well, essentially, it was a six-fold methodology. The trend analysis was looking at the facts, the epidemiology, the economics, and so on. But what I'll try to describe are some of the other steps. The first one is the futures wheel. I'm not going to get into these in great detail, but just to illustrate the kind of thinking, doing a futures wheel is kind of like doing mind mapping. So you start with, the trend and what's going to happen. And then you think about, why would that happen? What were the drivers? What might be the consequences? And so you start to link issues of health with education, with the economy, with social institutions. But most importantly, it's about also testing this with wildcards. So here's some wildcards that we thought about at the time, whether there was going to be, weather events, whether there was going to be famine, whether there might be war, other kinds of disease outbreaks. So you test your scenarios with these wildcards to see what might happen and whether these scenarios might then go off in different ways. Then we thought about the intersection between the different kinds of impacts. So here we were looking at social, technological, economic, environmental, and political. And from there, we go on to scenario building. And this is really the most fun and creative part, where we said, let's see what might be the different kinds of scenarios once we take account of the social, the technological, the economic, the ecological, and the political trends. So these were 4 scenarios we came up with back in 2020. The pessimist was a dystopian future, a life post-COVID where society fell apart. There was social unrest, breakdown in the rule of law, rise in criminal gangs, people lost faith and trust in authority as examples. Health system collapsed, health workers resigned, walked out. There began to be an informal health economy, and poverty was widespread, economy was bankrupt. So that was the dystopian view. Then there was the new normal, where COVID is just partially tamed, but the state had to constantly impose more order. Outbreak gets contained, but it resurfaces. US-China tensions threaten to cause the WHO to collapse. Widespread unemployment, bidding war for the vaccines, states turn inward looking. Immunity passports come in, and WHO is struggling as countries also try and figure out their directions. Then there was the optimist view, where the vaccine's on the horizon and we recover. We go back to the pre-pandemic days, but we're doing even better with more progress. We flattened the curve, businesses reopened, but stimulus funding is helping the economies to grow. There's good trust in government because people have benefited and vulnerable groups are supported, and digital technology use has exploded. And finally, the fourth scenario we had is really kind of two different worlds coexisting, where yes, the pandemic comes and go, there's some recovery and some funding, but the population, society, it's fragmented. The health system becomes two tiers. The people with immunity passports get to do things. Other people are excluded from social activities. There's good private sector innovation that has happened, but others are left behind. So I'm sure when I describe this to you, there are elements that are familiar. What we identify was, despite differences across these scenarios, there were going to be some shifts that was going to be universal. We will see behavior change, and more things people know about and they can do at a distance. We're going to see people more focused and understanding of mental health. We will see new business models, new forms of healthcare because of the digital revolution that has been accelerated. We believe that government's role was going to be much more expected. And then the inequalities would actually also increase. So these were some of the things that we felt we could reasonably expect across the scenarios. And from there, what you do really depended on the governance system, the politics, the ideology, and the values in society. So here, in order to help the WHO think about how to work with different governments in the way that WHO provides support, we started to think about the different political orientations, the different social values, and whether with the different scenarios, governments would actually move in different direction. So from there, we can backcast and we can think about, for each of the scenarios, what does it mean? And what do you want? What should you do? And so this is really also a choice about what don't you want and what should you do to prevent a certain scenario from happening. And then we went through to work out what is the WHO and how does it work. And from there, we looked at if there were preferred scenarios in 18 months or 2 years' time, and working backwards, where should the WHO be today in 12 months, 15 months, 18 months? So that's really the backcasting process. So what did we actually conclude for the WHO? We told the WHO that they really needed to help countries to develop more resilient and future-proofed pandemic preparedness plans so that they can actually protect themselves against the worst scenario. We said countries must not lose sight of universal health coverage, because if you haven't got a health system that was prepared, you're not going to be able to respond appropriately. We wanted the WHO to support countries to really embrace digital health technologies as a way of transforming the health system, which includes better quality, better access, and being more responsive. And we wanted the WHO to strengthen the support on ensuring mental well-being and give that much more attention across countries. And we wanted WHO to remind countries to ensure that they didn't put aside all the other disease control programs, whether that's maternal and child health, immunization, non-communicable diseases, and that all the needs of the population still required attention. So the interesting thing about this set of conclusion is that it actually went beyond business as usual, because in the world of large, complex, bureaucratic organizations, you have many vertical programs, and something like COVID might have been seen initially as something just for the health emergencies program. And it's all about, global health security and joint external assessment and ticking the boxes on pandemic preparedness planning, which does not address many different issues. So this really led to a pivoting of the entirety of the organization to the COVID response. Now, later on in 2020, we did do some reflection as the various think tanks work its way through, moving towards a futures forum. And we thought that, in reality, it's not going to be 4 different scenarios. We probably would end up with a mixed scenario that required lift and suppress. And this is indeed where we are. We thought the 4th industrial revolution of digital technology would really accelerate, and we have certainly seen that. We felt we needed to work to ensure the equity impacts were not forgotten, both within countries and across countries. This one, we still need to really keep our eyes on. We thought that organizations needed to pivot, and it did. But we wondered about the future for evidence-informed policies and many other issues in global governance, and whether things will change or whether things will revert. And that's an interesting point to talk about. But we also reflected on the methodology and the process. Now, this was a rapid process, so it really is a matter about getting the range of people around the table. Had to be a right mix, people who knew the evidence about the virus, about the social impact. And we found that having a multidisciplinary group with people who understood different countries and different population contexts was very important. And this type of exercise, bringing in the diverse disciplinary inputs, was very helpful for people who were otherwise very narrowly focused on the details, the technical details of the disease, the virus, the clinical presentations, and important as it might be, they may in fact manifest themselves differently. And we certainly found it was a very helpful process to get the different stakeholders onto the same page. So let's move to 2022. And here we are. What does this look like in retrospect? I think that we can, in fact, be reaffirming the value of this foresight when we think about the domains of impact and action we were most concerned with. Certainly, we saw the unleashing of new technology, but sometimes without necessarily assessment of risks or impact. We certainly have seen politics and governments being hijacked. We've seen perhaps a lot of discussion about, is it globalization in a different form? In the communities around the world, we've seen communities, all of us, living with uncertainty, stress, and pressures, and greater inequalities and vulnerabilities with polarizing and fragmented societies. But we've also seen people come together, being much more health conscious and thinking about my health and your health are actually intertwined. In the health system, everywhere, we see a workforce that's been pushed to the limits. We've seen loss of life expectancy, and we certainly see the world's eyes on the WHO. So I think that exercise we can reaffirm the value of the exercise. And what would we actually learn in terms of thinking about where it can help us? It certainly helped us map the complexity for more holistic response. It highlighted emerging issues. It moved us to consider a full range of possibilities. I mean, back in 2020, Donald Trump was definitely one of the wild cards we talked about. But we also considered strategic opportunities, getting a recommitment to universal health coverage, indeed to the Sustainable Development Goals. So having done this kind of exercise, we can see it's not just for the pandemic, but it has greater value. And the WHO at headquarters is now certainly looking at developing a foresight function within headquarters, and with it to support all different health programs. And essentially, using foresight is about asking some critical questions. Firstly, what's changing and what's driving the change? What's the longer term dynamics that will change things? What might be the impact of these emerging changes? What are the alternative scenarios? And what are the different futures that these changes can occur? And then we go to the normative. What's the future we want to build? And how do we create the change that we want to see? So it does take you from the analytical, the multidisciplinary consideration to a normative approach. So in conclusion, I think that when we reflect on the last 2 years, we have seen rapid collaboration of the STEM scientists in medicine, in engineering, the data scientists, the lab scientists. What we could see more, or what we need more, is more collaboration of social scientists and collaboration across STEM and social sciences with economists, sociologists, psychologists, political scientists, because I think this is what a foresight approach demonstrates the value of this very broad interdisciplinary collaboration. So if we have more interdisciplinarity and more focus on implementation science, perhaps we can really move the world a bit further to creating the kind of futures that we want to build as we emerge from COVID. And if we also could bring in stronger evidence for foresight itself, as well as for translational work, I think that can really propel us to a better place. So let me finish there, and thank you very much.
Thank you, Professor Lin, for that most informative discussion and opening up the whole question of foresight analysis and approaches. We've just run out of time, but we have just 1 or 2 questions. Priyan, would you like to put out your question on where does this capacity reside?
Yes, so I just want to know whether the UN system wants to promote these kinds of studies, and maybe among governments or even among academies of sciences. I mean, speaking from our own perspective, because it does not seem to me, it's not a very widespread expertise, right? I mean, can you comment on that?
It is a fairly small group of experts, and the experts are not content experts in the subject matters, but they're methodology experts on what's the range and what's the process, what do you need to do to help people do that. The UN system is very interested, and there are now many UN agencies that are looking at how do they bring foresight in better. I believe UNESCO for a number of years did have an in-house futures expert as well. So
Maybe
perhaps
insurance companies have them, right? Maybe insurance companies have them.
insurance company might be more responsive, but what the Western Pacific Regional Office certainly is doing is now supporting countries to actually look at doing this better. Now, we do have some countries like Singapore, which has long-standing presence of a Foresight unit. And I think Singapore has been, pretty well served. But for low and middle income country, there's no reason why they could not also do this. So that's certainly part of the process.
Thank you. There's a question by Elisha Nasruddin. Question is, the value of futures thinking comes from the ability for imaginative collaboration for a better future. Yet, how did your exercise highlight the resilient society of the future?
Let me think if I understand, highlight the resilience society. I think when we actually, it's almost by definition that when we take a futures approach, we think about resilience, because at any point in time, there will be shocks. And how well do individuals, groups, communities, nations, our planet respond to the different shocks? And so when we think about the future and we look at the wild cards, we anticipate different kinds of shocks. We start to raise also awareness about how do we actually build the resilience and what does it take? It might look different in different places. Your starting points will be different. Your culture, your governance arrangements will be also different. But I think by bringing in an multidisciplinary perspective and an understanding about how different sectors have experienced shocks and recovered, it helps strengthen our capacity to deal with it.
Thank you, Professor Lin, and thank you so much for that very interesting and very, novel approach that has been presented. Thank you.